Hi, I'm Samir Gupta, Cardiology Fellow at the University of South Florida in Tampa. I'm here at ACC 2012. Let's go ask the experts some advice for fellows who are interested in a career in interventional cardiology.
Well, I think one of the most important things is that if you're dedicated to doing a career in interventional cardiology, that you go ahead and do it. Don't be dissuaded by comments about there won't be any interventions to do or why are you bothering to do that. If it's something you want to do, go ahead and do it because you never know what the future is going to hold.
I guess there's a couple of things. I mean, this is a great time to be an interventional cardiologist, obviously. There's lots going on in coronary interventions, structural interventions, neurovascular interventions, and peripheral interventions. So the first thing I think you've got to decide is how many of these things you want to do. I think the goal has to be you cannot possibly do everything well. So you've got to decide how many things you want to do, and then find yourself a place where you can potentially pursue the career that you want to do.
Well, I think structural heart disease is one of the most interesting fields in intervention for quite some time. And there's a lot of excitement, and people want to get involved, and people want to be doing these procedures. And as a fellow, I think it's particularly difficult because there are very few training programs available, particularly in the United States. And to get into those training programs is, quite difficult. I think one of the keys might be to identify somebody even outside the United States where you could potentially go and train. And as we mentioned, I train in England. And one of the advantages of training in Europe is CE mark comes so quickly. You have access to devices you don't have access to in the United States or Canada. And you can train on these devices and you can come home and bring back some new skills.
Well, I think it's vitally important to get trained in a variety of modalities. I think while coronary intervention is really the bread and butter of what we do, I think it actually behooves a fellow to try to get some additional training outside of the coronary tree, either in peripheral or structural disease, if they're really planning on a more clinical career. Now, for those that are really interested in investigative careers, it may be hard to really focus on multiple clinical modalities and maybe sort of pick one particular area to really focus on and focus their investigative work in that area as well.
There you go. This is Samir Gupta reporting from the University of South Florida, reporting for Fellows on the Go blog news team. Stay tuned for more information. Please go to www.cardiosource.org/fit.